Okay, so I guess I'll start. So, Professor, thank you so much for giving me the opportunity to share a little bit about Singapore. This is a bit of my home to yours. So, to begin with, I'm sure most people here are familiar with Singapore, just the same way we're familiar with Korea. It's a city-state. The population in my country is about 6 million people. Very small land area. It measures 50 kilometers east to west and 27 kilometers north to south. Tiny. And population density is about 8,000 people per square kilometer. It's less than in Seoul, but still pretty high. One of the things that we are quite, I guess, proud of in Singapore is that it's called a city in a garden. So about 40% of our land area is actually covered in greenery. And we try to do that because, it's very hot in Singapore. And if you're seeing buildings all the time, everyone will go crazy. Right? So this is just a quick slide comparing the demographics of our patients in Singapore and in Seoul. So for once, Singapore is actually a little bit bigger. 734 versus 605. But Seoul has like double the population of Singapore, 10.1. And within the greater metropolitan area is 25 million. So huge number of people. The median age in our country is about the same, 42 versus 46. We also have an aging population in Singapore. It's about 20.7%, about the same as Korea. The prevalence of diabetes is also high, 9.1% versus 12.5%. And we all have old patients, right? So 84, 84.6. So the kind of problems that we see, very, very similar, which is why I think training here is very good. So if I'll start with the people of Singapore, where we are a little bit different from Korea is that we are fairly multicultural. So in terms of the ethnicities, we have 4 major ethnic groups in Singapore. Majority here is Chinese, 74%. And then we have the Malays, which are, I guess, the indigenous people around the area, 13%. We have Indians, 9%, Eurasian, 1%, others, 3%. So because we are a multicultural society, I'm sure the food scene in Singapore is probably most famous thing. So in terms of the hawkers, we have cuisines from all 4 different cultural groups. It's reflected in our architecture as well. So you can see the various, I guess, like Chinatown, Little India, Geylang, which is like the Malay town. It's all different architecture. And the working language in Singapore is English. But you can see our signage, by default, we have 4 different languages. So this is very, very iconic for Singapore because we have a lot of construction sites. So we always say, danger, keep out, 危险. Then, everything is in Malay and Hindi as well. Speaking of the people, these are the ones that are closest to me. So that's my daughter on the top right. She's 11. That's my wife. And that's my son going to kindergarten. He's 6 years old. And then over there, that's my family. So that's 15 of us. There's 3 generations. We all stay very close to each other. So we are always meet, like having dinner and meals together. And then this is my home. This is my alarm clock in the morning. I don't know if there's a sound. Yeah. So this one, this is Silky Chicken. So I've got 2 of these. His name is Tofu. This is Tofu. The other one is called Toothless. Yeah. So that's my alarm clock. This is my department in Singapore. So Singapore General Hospital is the first department in Singapore established in 1972. So I'm one of the 10 consultants there. And we also have 3 associate consultants who just joined us. Essentially, as the first department, we are the referral center for microsurgery, craniofacial, full spectrum, apart from pediatric. We're also home to the National Burn Center, so this is a national resource. So actually within the region, we're the only burn center. And we also have a American Tissue Bank accredited skin bank with CEA capability. So occasionally we handle major burns from around the region as well. In terms of the cases that I do, it's a mix, so a bit of hair and neck, but mainly breast as well as lower limb. Those are the common referrals that we get, and some skin cancer as well. And also we have started doing a multidisciplinary clinic together with vascular surgeons, which is why I wanted to come and learn from the lower limb team here. We see many cases like this in our combined clinic with vascular, and in the overwhelming, I guess, majority of cases, it all boils down to good wound care, because a lot of these are actually venous ulcers. But we do get DFU and we do flaps for that as well. I also have an interest in lymphedema. So there I've been on a course with Yamamoto Sensei, so Dr. Takumi Yamamoto, and we were doing some LVAs, and I'll be visiting him after I leave Asan for 6 weeks. In terms of the research, so I conduct microsurgery training for the residents, as well as some of the medical officers. So I guess, I'm not sure, like the interns who come by to our department. So every 6 months, we have a lab, and then we can book the facilities. We have about 12 scopes, and we just try to do some chicken feet, chicken thighs. We also have, like I said, CEA, so we have done some research on that, and I'm working with the local, well, not local, the national scientific kind of body. It's called A-STAR, to develop synthetic 3D printed burns dressings. So we're doing a human trial on that. Yeah, so that's me. I've been here for about 2 weeks and a little bit. I feel like it's not enough. I would like to stay for longer. I wish I had more time. But just in this time, I've learned a lot. So I would say my top 4 learning points from AMC. First of all, I think the multimodal treatment for lymphedema, both in terms of not only the conservative, but especially the surgical. So learning how the preoperative workup, the surgical techniques that are being used, like BioBridge, lymph node to vein, the scar releases for the axillary, for the upper limb lymphedema. A very high-tech surgery here as well. I'm very happy to have seen the Simani, as well as the use of exoscope for remote surgery. The ultrasound flap mapping is also something that I'll be taking back to my center. I've already asked my boss to buy a Apleo ultrasound. It's about $150,000, so I don't know if he'll approve. And of course, the warmest hospitality. So I'm very thankful for this time that you've given me, and I've learned a lot. I've got many fresh insights and many new friends. Okay, so that's the end of the presentation. If you are ever in Singapore, please look me up. That's my email, yeah, and that's my mobile number over there. And we are welcoming to anyone. Thank you.